Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to be talking about a condition called corneal sequestrum. A corneal sequestrum is essentially a scab on the cornea, on the surface of the eye. It's a condition that we see fairly commonly in cats. We rarely ever see this in dogs. Occasionally it can be seen in horses and in rabbits, but cats are the predominant species where we tend to see this condition. So there's a number of theories about why this occurs. Anything can trigger this. So if you have a long-standing ulcer, so if you have a defect in the surface of the eye for a period of time, it can start turning into a sequestrum later on, where it starts turning brown or black. Um, in some cases, it can be caused by viral conditions involving the surface of the eye. Sometimes it can be due to a trauma. In a lot of cases, it's just a combination of several factors. So usually in cats with very short noses, where they have poor eyelid conformation, very poor tear production, and a lot of exposure of the surface of the eye, and they can spontaneously develop a corneal sequestrum, usually right in the very center of the eye. Although any cat can get this condition, we do tend to see this condition a lot more in short-nosed breeds, so in Persian cats, in British short-hair cats, and it's more likely to reoccur in these patients. So we're likely to see it more than once in these patients, particularly if the underlying issues with the tear film and the eyelid conformation are not addressed. That depends on the case. So if you have a short-nosed patient with a sequestrum in one eye, I usually warn the owner that it could happen in the other eye as well, or it could potentially even reoccur on the same eye. If it was due to some sort of an ulcer or if it was due to some sort of a trauma, it's less likely. But again, it depends on the situation. Most cases of sequestrum, unless they're in a short-nosed patient with several underlying issues, tend to remain in one eye. Well, unfortunately, this is a condition which doesn't tend to respond very well to medication because it's usually quite a painful condition. And even if it's not painful, or even if it doesn't appear to be painful because the cat's not showing a lot of eye issues with it, it shouldn't be ignored. And the reason it shouldn't be ignored is if you leave it for long enough, the sequestrum will become denser and solidify, and it will go deeper and deeper and deeper into the cornea. And in some cases, it can physically slough off. And once it's sloughed off and it has gone very deep, there might be trouble with the structural integrity of the eye, and that may end up in loss of the eye. So the treatment options that we usually recommend for this condition is surgery. So we take off the affected part of the cornea. We try to take out everything that is black or that is a sequestrum. In some cases, it's only very superficial, and we get away with just cutting it off and leaving the cornea to heal. In some cases, we physically need to put a graft of some sort over the defect if it's gone too deep, and that could be the cat's own cornea, where we make sort of an advancement flap from the side, or in some cases, we might need to stitch other tissues over the top to reconstruct the cornea. One of two things can happen if you do nothing. In some rare cases, the sequestrum may fall off by itself and leave a clean cornea behind. And if you're lucky and it's not that deep, that could be the end of it. In most cases, the sequestrum will just become denser and get deeper and deeper and deeper to the point where surgery is going to be a lot more challenging. Or if surgery is not performed, and the sequestrum sloughs off and leaves a defect, which is either very deep or full thickness through the cornea, that might end up in loss of the eye. So hopefully you found this video interesting. If there are any comments or questions, please feel free to put them on below. Bye bye.